Anita and her partner are about to have a baby. They have approached this pregnancy with love and ceremony, informed by their cultural perspectives that this is a sacred time. Anita's support circle has encouraged her to be strong and stick to what she knows for her pregnancy, birth, and baby. While in labor, Anita calls her midwife, who tells her to meet at the hospital. She also calls her aunt and cousin for support. The midwife hurries to the hospital from a home visit. However, Anita arrives at the hospital before her midwife, where she finds that her pain is dismissed and her partner is not heard. There is a lot of noise, bright lights, and the waiting room feels cold and sterile. She feels unheard and vulnerable. But with her partner, family, and midwife by her side, she pushes through. Finally, her baby arrives, happy and healthy. In the quiet that follows, Anita gently breastfeeds, holding her baby close. Shortly after the midwife leaves, the baby is taken from Anita with no explanation, only that it needs extra care. Confused and anxious, she hears staff whispering about her being Indigenous and questioning her ability to be a mother. When Anita and her partner ask for more details and if they could come with the baby to the nursery, staff abruptly tell them that they shouldn't worry since the baby is now safe. Anita tries to reason with a nurse. "They won't let me hold my baby, and they don't explain why. I can see that other mothers are able to hold their babies." Anita is told the baby is being tested for substance exposure and that a social worker must confirm her home is safe before leaving the hospital. No one will listen to Anita and her partner. It's as if their voice doesn't matter, even though they deserve quality care and respect, and for their experiences to be protected. Because the healthcare system is rooted in colonial structures that perpetuate anti-Indigenous racism, new parents often struggle to advocate for themselves. But Anita's midwife and the Indigenous navigator step in, addressing the staff and outlining the issues and necessary changes. Their support circle holds up the family and protects them from the harms of systemic anti-Indigenous racism, a reality that has gravely impacted generations of Indigenous peoples' experiences and access to health care. Later, the midwife and navigator work on a committee to make changes to hospital policy so this never happens again. Like Anita and her family, it's time to draw on the collective strengths of the community and policymakers, so every family receives a respectful, uplifting, and caring healthcare experience. It's time to rise in that collective strength.